Thank you, Madam Speaker, and thank you to the Honourable Minister. The crisis, the humanitarian crisis in long-term care homes has been a concern for all Canadians, no one more than for Green Party leader Annamie Paul, whose father died in a long-term care home in Toronto at the beginning of the pandemic. And we have been providing a lot of very specific recommendations, some of which are in the NDP motion today. So my question to the Honourable Minister is really around what more can we do in the approach the government is taking. I personally support the notion that we need an emergency summit of federal provincial leadership to actually think about whether we can't do better and overcome the jurisdictional barriers. But I listen to people like President Sharleen Stewart of the SEIU union, and what those workers are going through and continue to go through. They're not going to be able to absorb new people who are on a learning curve when we're still in pandemic. And I ask the Honourable Minister what more can be done and if she's more open to some of the solutions that are before us today.
Sure. Thank you so much to the Member of Parliament for, as always, a thoughtful question. And first, let me just give my condolences to Ms. Paul. I mean, it is a tragedy to lose a loved one, and I can't imagine the pain that she's gone through like so many other Canadians. First of all, let me just speak about the treatment and pay for long-term care workers. You know, my first job, if you will, for the federal government was Minister of Status of Women. And you may remember, the House may remember the many debates that we had about pay equity and also the gender wage gap and the historic underpayment of people who provide care. And I think this is a really powerful reminder that we have a lot of work to do in how we value what we consider care work, whether it's care of seniors or care of children. Care work is undervalued, and I think that there is a significant gender bias there. There's questions and